Every day, more than 115 people in the United States die after overdosing on opioids. But how does this happen, and how can we stop this ongoing national epidemic? My name is Maria Varela, a supporter of Oral Surgery and Dental Implant Center, the only opioid-free practice in Wichita Falls, Texas. And I'm here to speak about my take on this opioid epidemic. As the opioid epidemic has made its way across the country, the number of opioid-related overdoses among teens continues to rise. But what do teens even know about opioids? Well, I decided to do my own little research, and I spoke to 20 18 to 21-year-olds, so about college age. And I picked their brains a little bit just to see their knowledge on opioids. Some students were students at the University of Texas, and others were just friends from home. I would say about half knew what opioids were and knew that they were becoming a problem, and the other half would just seem confused and had me explain what an opioid was. Well, I would give a brief overview of the crisis, and they would say something like, "Oh yeah, I saw that on the news," or just something like that, like it rang a little bell. And others would honestly say they had no idea about the crisis or the gravity of opioids in our society. I asked them all if they knew anything about pain medications used for surgeries like wisdom teeth removal, fractures, and so on. But nope, no clue. I honestly hardly knew anything about the crisis before Dr. Vergara's opioid-free campaign, so I can't blame anyone for their lack of knowledge on the drugs. But my point is that a huge chunk of these people don't know the dangers of these prescription drugs. People go to their doctor, get prescribed potentially dangerous and addictive medications, but are not told the risks or the alternatives. Just to give you a brief overview of the epidemic, let me just pull out a few facts. Well, the National Institute on Drug Abuse states that roughly 21 to 30% of patients prescribed opioids for chronic pain misuse them, and between 10 to 12% of those people develop a disorder. Crazy, right? Well, it's estimated by the year 2020, we will lose about 100,000 people per year. Just let that settle in. It's almost 2019, and we're losing people every day to this. Most parents think their child would never do drugs, let alone get addicted to them. But the truth is, addiction can happen to anyone. I know these are scary facts, but educating ourselves on these prescription drugs, these opioids, is a very important first step. The opioid epidemic is a national issue being battled from all sides, from people researching the crisis and finding alternatives, in the medical field with doctors prescribing them every day, and even the government passing legislations to help the crisis. Well, just recently, the Senate passed the Substance Use Disorder Prevention that promotes opioid recovery and treatment for patients and communities. So for short, the SPORT Act, which tackles prevention, treatment, recovery, and enforcement. But like I said, government and officials are not the only ones combating the crisis. After speaking with Dr. Sandra Vergara over the opioid epidemic, she said the problem lies in the healthcare providers because 1, not educating or warning their patients, and 2, for overprescribing. People blindly take their prescribed opioids without knowing the consequences. They start liking it, and then they start taking more and more and more. That's the problem. Well, she told me that people have told her that they're scared of not getting narcotics like fentanyl, hydrocodone, and oxycodone because they think they'll be in pain. When in reality, alternatives like Exparel perfectly get the job done. Painless and without risk of addiction. Dr. Vergara, in fact, transformed her practice into the only opioid-free oral surgery practice in Wichita County. We can take a step closer to an opioid-free society by listening, reading, and educating ourselves on opioids in the crisis. It is important that you know that it is okay to ask your doctor what they're going to prescribe you, because simply by educating yourself and even others, you could be saving someone from addiction. Be part of the change and choose opioid-free.